Minister, you mentioned earlier that the government are going to be establishing a rent register, and it's absolutely crucial that that's established, particularly given the report this morning. However, this has been promised so many occasions. When exactly will renters in this country have access to that rent register and to the information? Will they have access to it before the end of this year?
Yes, thank you very much. Deputy Pearse Doherty.
Minister, I want to raise the issue of overcrowding. We know that last month 8,000 sick people and injured people were left without a bed, an increase on the previous year. We know scandalously that 30 of those were children. In my own hospital in Letterkenny University Hospital, it's at the top of the list in terms of the number of patients in trolleys and in wards time and time again. This morning as we speak, there are 27 people on trolleys in that hospital, and every day last year on average there were 19 people on trolleys in that hospital. Now, Minister, what's scandalous is that there is a ward with 19 beds lying empty because the government won't provide the necessary resources that the hospital management asked for 1.5 years ago, and instead we have patients lying in trolleys as a result of that. Now, we have launched a campaign, myself and Senator Padraig McLaughlin. There's been a huge response with thousands of people signing a petition demanding that action is taken, that we give dignity to ill people instead of being lying on trolley, that we open the ward that has the 19 beds and are treated properly. So can I ask the Minister, will you finally, because I've raised this time and time again, will you make the necessary resources available to open the ward that is there, that has been lying empty for year after year, and take patients off the corridors and have them treated in the ward?
Minister.
Thanks, Count Corla. I can acknowledge and genuinely admit that anybody that's obviously waiting on a trolley is in a distressful situation, and so therefore anything that can be done to alleviate that stress can and should be done. This morning's numbers on the trolley car are 284 people, which first of all can I say is 284 people too many, but it is a reduced number of 17% on this time last year. So the only thing I can say to you, Deputy, is that the extra €608 million taxpayers' money that was allocated to the HSE last year, with the HSE service plan delivering and promising to deliver the 4,500 acute extra beds, the 2,600 step-down beds, needs to be sped up. And actually, I think probably what needs to happen is that the Sláinte Care team probably needs to work more closely with the HSE in delivering a service plan next year.